Hip internal rotation. We live in a world of hip openers, and so we spend a lot of time opening, pigeon, open. And that's fine and dandy. We still need to do it. The problem is that we're losing internal rotation. Internal rotation is a component of being able to flex fully. And you'll say, I can flex fully. I can get down there, or if I do knees to chest, I can get my knees to my chest. Well, you can make it happen. You can always make it happen. But try, and maybe you'll feel it and maybe you won't. There's a lot of time, well, every time I bring up a patient's leg very gently, I can feel where their hip is done moving. And the only reason why they're getting the full motion or close to full motion is because their backs are flexing to make up for what is not getting done in the hip joint. And that's really why they tell you not to bend over, you get herniated discs, things like that, because if you don't have the mechanical flexion of your hip, this will flex for you and you will feel it in your back, which is why a lot of back pain comes from lack of hip mobility. If you cannot internally rotate and you look down at your leg and it will not turn out, you can't get the last component of full flexion. So you need internal rotation. It's just that it's an awkward motion, so you don't promote it, and there's not a ton of exercises and stretches and positions that help promote you to gain nor maintain internal rotation. But what happens if you cannot move this way? Guess what gets tight? Part of your butt, the outside of your quad, outside of your hamstring, and you'll probably get diagnosed with anything from hip bursitis, IT band syndrome, patellofemoral pain syndrome, because this will get tight, it inserts here, it'll affect your knee. If you don't get internal rotation, this tension will not change, but nor will your hip motion. So now your hip's getting stiffer, you can't flex, your back hurts, and you hurt down the side of your leg anywhere from here to here, because it does even affect down to the ankle, and could be why you have plantar fasciitis. So hip internal rotation is a pretty important component in order to have regular motion mobility, but also to lose the unusual lateral line tension and also reduce the flexion moment at the back.